Good evening and namaskar, and welcome to a new episode of Africa Talks. Today we'll be discussing about the infodemic of fake news and misinformation during the COVID-19 crisis. And today with me, there are three eminent panelists who will be giving their insights about this. First of all, I would like to welcome Mr. Idris Mohammed. Mr. Idris is the founder of Sulu Development Initiative, and he has been working on democratic governance, peace building, fake news, misinformation, and related issues in his own country. And he is joining us from Nigeria. Mr. Mohammed, welcome to India Africa Today's show, Africa Talks.
So you're welcome.
Our second panelist today is Dr. Sarvesh Tripathi, who is coordinator of PhD program at University School of Mass Communication at Guru Gobind Singh Indraprastha University, New Delhi. And Dr. Tripathi has more than 3 decades of experience as an academician and as a media professional. So Dr. Tripathi, I welcome you to Africa Talks.
Thank you.
Our third panelist today is Mr. Iziogu Namdi, who is a Pan-African and is co-founder of Exilient Africa. Welcome back, Mr. Namdi, to the show.
Thank you very much.
Friends, we all know that in the last 7 months, the COVID-19 pandemic had spread to more than 200 countries across the globe and infecting more than 5 million people and killing more than 0.35 million people across the globe. We are startled at the rapidity with which the pandemic, spread from Wuhan in China to so many other countries in a span of just few months. But we also noticed that the pandemic did not come alone. The pandemic came with an infodemic, the infodemic of fake news, misinformation, propaganda, and also a lot of cyber security related issues. So today we'll be discussing more about that how world is not only fighting a pandemic, but also an infodemic. So starting with our show, first of all, I would request Dr. Tripathi to give his views about the whole infodemic of fake news, propaganda, and misinformation in the context of COVID-19. Dr. Tripathi.
Yeah, thank you, Narender. You see, the effect of any epidemic or pandemic is limited, maybe limited to some years, some months, but simultaneously, if there is infodemic, its effect may be long-term effect. So that is, I think, along with pandemic, if infodemic parallel runs, then it is supposed to be more fatal, more dangerous for the social fabric, for the integrity of a country, for the unity and integrity for the country, and also for the security of the people. So it is also posing a threat to our society as well as the nation. And not only in India, but in other countries also, the otherization is rampant. And when there is a pandemic, then people, they seek an enemy. What is happening right now, that it is a human tendency. If somebody is responsible for this pandemic, they always try to seek an enemy. Just as you would have seen that, and this is a game of hatred. The game of hatred is continuing everywhere. Maybe behind this game of hatred, there may be certain vested interest, may be political. Just as Iran is holding responsible Trump is holding responsible China. Italy is, up to certain extent, there are certain news items that even when there were very few cases in Africa, very few, and very much cases in Italy, Italy held responsible Africa. Simultaneously, Thailand hold responsible white people. Then Sri Lanka hold responsible a particular community. Pakistan hold responsible Shias. In India also the same trend and tendency is being observed. India also is holding responsible either this community or that community or this people or that people. That is the game. And in
So,
the
so, so a lot of propaganda is going on right now globally
yeah,
in the context of COVID-19.
sure.
That's what Dr. Tripathi is trying to say.
Yeah.
Coming to Mr. Idris Mohammed, if you can give us some insights about the implications of this infodemic in Africa, particularly in your country, Nigeria. Mr. Idris Mohammed.
Okay. Thank you very much. A lecturer at the Department of Journalism in Nigeria. So I'm also familiar with the issue of fake news, misinformation, disinformation, and mistrust that is popularly known, or that is the main issue in the pandemic in Nigeria. So let me go deep directly into the topic in Nigeria. You know, the issue of COVID-19 came to Nigeria with a lot of misinterpretation and misinformation concerning the issue. This happened as a result of so many cases and so many issues. The major issue of misinformation in Nigeria is the issue of conspiracy theory concerning the COVID-19 in Nigeria. There is religious conspiracy, there is political conspiracy, and also there is social conspiracy. When you talk on the issue of religious conspiracy, we are talking about the issue of religious bodies like Islam and Christianity. So a lot of these religious bodies are looking at the issue of COVID-19 is the issue of intervention or interruption of Westerners to stop the Africans from exercising exercising their own religion. That is the major threat here. Muslims will look at it that like it's America or any Western countries try to reduce the population of Muslims in Nigeria. That is the major conspiracy in Nigeria. And a lot of religious bodies are going offline and telling the world that this COVID-19 is not real, doesn't exist. And even if it is real, it's not affecting the Muslims or it is not affecting the Christians. This limited the campaign against
Mr. Mohammed, I think there is some audio problem there. So
Nigeria.
Mr. Mohammed was
on the issue of politics are coming with different narratives. Yes, what he said.
Yes, please go ahead.
What he said, yeah. What he said. Hello.
Yes, Mr.
Yeah,
Idris.
please go on.
Please go ahead. Yes.
Yeah, I'm coming also from the political angle. So a lot of politicians are coming with different narratives, negative and also positive narratives on the issue of COVID-19. So politicians are taking it as trying to portray the failure of the current government, or the current government is trying to distort the information coming from the opposition concerning the issue of COVID-19 in Nigeria. So there are a lot of fake news, misinformation, disinformation, mistrust that distorts the real information concerning the issue of COVID-19 in Nigeria. So this misinformation and disinformation create a mistrust between the people and the government. So whenever government came out with the issue of COVID-19, people will start asking the credibility or integrity of the even information or even the existence of the disease in Nigeria. So this hindered the campaign against COVID-19 in Nigeria.
Okay, so Mr. Mohammed was saying that a lot of mistrust is being created between people and the government because of the spread of misinformation and the spread of fake news. Coming to you, Mr. Iziogo Namdi, you have been interacting with a lot of youngsters, youth, who are studying in different universities, colleges. Do you see any kind of, any impact of fake messages being circulated maybe on social media or on their WhatsApp groups or WhatsApp messages they must be receiving? Do you see any kind of impact of fake news among the young people on their thought process about COVID-19?
Am I audible?
Yes.
So basically, I think infodemics, if we would want to go by its definition, is an excessive amount of information about a problem which acts as a detriment to its solutions. So for example, a lot of people, as you've just asked with regards to WhatsApp group and social media information distribution, you'd see that a lot of people get messages that tell them to take particular kind of drugs. Some at some point, like in Nigeria and some other African country, there is a massive purchase of hydroxychloroquine. So there is a lot of things that people get, informations that people get from groups. And when they get this informations, they don't just keep it to themselves, they also further circulate it. And this is one of the reasons why false information or infodemics continue. And it's not the first time that it's happening throughout the world. When there are outbreaks such as this, you have infodemic alongside with pandemic and other disease outbreak. So I think for now, this is what I just have to say, that there is a huge contribution to the problem of infodemic through social media, because most of the social media platforms do not have proper checks. So informations are easily circulated through them. And it's actually difficult fighting the pandemic if we still have this as a challenge alongside.
Yeah. Okay. Dr. Tripathi, in India, we have seen during the last 2 months that attempts have been made in some part of media to portray a particular community as the main cause of spread of COVID-19 in the country. And I'm sure in other countries also, COVID-19 or the pandemic might have been an excuse or a reason to target certain specific groups or certain specific communities. So I would like to come to you, Dr. Tripathi, first. How do you view the whole Tablighi Jamaat controversy in the context of COVID-19 and the fake news and the propaganda surrounding it?
Yeah, thank you, Narendra. You see, it is that is called the infodemic. In the long run, it is said that it will hamper the entire democratic process of the country, and it is widely I am observing that democratic process of the country is under the threat. Moreover, it is also posing threat on national security and the social fabric, as I have told earlier. You see, what is happening here in India, the scenario is quite clear. Some kind of, you see, people's mind is being molded for certain interest. I'm not saying it is certainly a political interest, but in the long run, it may be. Just the phenomena of, in this way, the phenomena of US and India is a kind of similarity you can find there. In US also, elections are impending. So he is holding responsible to China, maybe. And in India also, the social division, there is an effort, continuous effort of social division. And this endeavor of social division has been intensified. So you can say the pandemic has given the people who want social division a weapon just to intensify their efforts. So it has been observed. So in this way, you see, there were not only made, so social media is very highly responsible, and for spreading this kind of misinformation, disinformation, the social media has been used as a prominent vehicle in India. But along with social media, the irresponsible television, what happens here in television, that is a fleeting media. So the verification, they want to deliver the news as soon as they receive it. So the problem is there is a lack of verification. Sometimes there is lack of proper verification, and sometimes it also happens that deliberately the editorial, according to their editorial policy, they go for that particular false news or fake news. This is deliberately done. In newspaper in India, what I have observed so far, most of the newspapers, they have they have responsibly acted. They have checked, and most of the newspaper, I'm not saying all. As far as one news agency also, video news agency also is responsible, that is ANI. There is a specific case. In ANI, there was a news that in Karachi, Hindus are denying
Dr. Tripathi, we can't hear you. Yes. So I think there is some audio issue there with Dr. Tripathi. Let's go to Mr. Idris Mohammed.
There are some news, there are some data.
Dr. Tripathi, can you hear us? Okay, coming to Mr. Idris Mohammed. Mr. Mohammed, do you see in Nigeria also the COVID-19 being used as a platform for propagating hate or inciting violence against certain specific communities? Do you see that is happening in the garb of infodemic?
Yeah, so you know, pandemic, the coronavirus pandemic came with different things and the new behavior to the people, especially the issue of lockdown. So, you know, many people have been locked for so many days in their rooms. So they have nothing to do apart from going online, getting a lot of news, propaganda, fake news, misinformation. So politicians penetrated through that social media. Let me just go back and say, a lot of misinformation and issue of hate speech, issue of incitement are going on offline. And this has been so many years going on in Nigeria before even the emergence of COVID-19. But they gain their access to social media because this is the easiest way to reach millions of people in Nigeria. So politicians use this medium to tell to the people that government is doing nothing to curb the virus. That is one class of the politician. Another class of the politician are coming with their fake videos showing that this COVID-19 doesn't even exist. It's only way that government use to collect money from the Westerners, from the donors, in order to continue indirectly against, you know, the people in power, or to stand up against people that are doing, or people that are at the front line of fighting the COVID-19 in Nigeria. So, you know, but in Nigeria, there is no issue of maybe Islam, Muslim, maybe citing against Christian on the issue of COVID-19, or Hausa citing against Igbos, or Igbos citing against Yorubas. No, it's the issue between the people and the government. And politicians are using that, or sending information that is capable of inciting people or capable of encouraging people to stand up against government. So that's the issue.
Okay. Coming to you, Mr. Izio Ganamdi, have you come across any news in the recent times where there have been racist attacks on Africans living in different countries because of the misinformation that is spreading, that, you know, they are bringing the virus along with them from their home countries and all? Have you come across this kind of news items recently?
Yeah, basically, I think that has happened it was more prevalent in China, even after all the people have been quarantined and some of them have been tested to be negative of the COVID-19 virus. Several of them still get this treatment, discriminatory treatment, when they go out to patronize shops and other local markets. But I think it's not just peculiar with China. It's something which we would experience. And lucky enough, the COVID-19 outbreak did not originate from Africa this time, like the Ebola did the last time. So we are a bit going to be safe from, you know, such kind of treatment. But studies have existed on the harms to health from misinformation, especially in times of any pandemic, epidemic, or endemic outbreak of diseases. This is also shown by the research on influenza and other infectious diseases by the University of East Anglia in the UK. Now they used a simulation model. It was found that misinformation and disinformation causes bad advice from social media, causes a lot of people to adopt behaviors that are very risky to them. So what we are looking at right now from our own end is not just because these things have been proven to be in existence for a long time. Wherever there is a pandemic, you have infodemic alongside, even not just with pandemicity. So we're looking more from an angle whereby people are oriented, and there's a kind of a media sensitization that will be carried out so that they don't just fall for false information. They are able to recognize false information. They are able to identify it and stop the spread of it also. So they serve as also a checkmate from this information spreading.
Okay. I think Mr. Mohammed, we lost Mr. Mohammed. He'll be back soon. Going ahead in the program, Dr. Tripathi, how to control this menace of spread of fake news through social media platforms?
So certain measures have been taken by India. So it seems that the existing laws are not sufficient. We have to promulgate certain more laws. Though there are existing laws, in brief, I'll tell you about the laws that deal with it. That is, you see, IT Act. One is IT Act. And under this IT Act, actions have been taken. Near about 51 cases have been registered in Maharashtra, certain cases in UP, Odisha, in different regions. So IT Act is an umbrella. And under IT Act, there are provisions for political interest, for the identity, the cyber scheme or hacking, defamation, or copyright, under that. Talking also, stealing the trade secret. So IDA is strictly propagated. However, in India, there were such rules that more than the IPC 1860. That is 5 of IPC 1860. There is a provision for the punishment for making or publishing any rumor or report which may cause fear. So this act can be also created.
Yeah. So I think there are several acts which are there, but Dr. Tripathi, my question is, how many people are taking these acts seriously, or are there any legal implications? Have you seen any kind of action being taken by the government authorities against fake news in the recent past? I think there is some audio problem there.
By the government. Yeah.
Yeah.
In UP,
Dr. Tripathi has mentioned about several laws that are there already. Do you think these laws are being used properly by the government agencies to ensure that there is no spread of fake news on social media platforms, especially Facebook and WhatsApp?
Well, I don't think, most times we have good laws on papers, but we lack the enforcement of these laws. So I don't think, to a wider extent, with the kind of issue, even the World Health Organization Director General during a press address in February had also mentioned that it's not just the virus alone that we're fighting. It's not just the COVID-19 virus, but we have also the virus of misinformation. So I think it's something that the world needs to stand up together. Governments need to come up together, and they are not just coming up together to the fight for this. Actually, the ways that I see to combat the effects of fake news will include their reduction, because if we can actually get the source of information, see all of these portals where misinformation and mass disinformation are being carried out are portals that, if Facebook, for example, or WhatsApp, which also belongs to Facebook, and can be held accountable, these things can be curbed, because such groups would not be allowed to exist. You know, so, and also there is a very, very important need for mass immunity, and mass immunity, we can only get that from infodemics. Mass immunity from infodemics can only be attained when we have a system of sensitization and citizen awareness. People need to know what news is a fake news. There are certain properties of an information that makes you understand that this is a fake information, because the harm that these informations would cause are very greater, and we shouldn't allow that in the society.
So media literacy could be one way to tackle this infodemic. If
Very important.
people can identify and understand and differentiate between a genuine news and a fake news, I think there are chances that they won't be forwarding it to other people. Coming to you, Mr. Idris Mohammed. Mr. Mohammed, we were discussing different ways to curb this menace of infodemic. What would be your suggestions to ensure that the kind of misinformation that is spreading, how to curb it in the coming days?
So my own is from democratic governance point of view. You know, there is a very wide gap between the government and the people. First of all, government have to win the confidence and the trust from the people. If government lost that trust or doesn't have confidence to the people, there is no way government can communicate to the people directly, because it is that gap that government create, because government maintain so many years lying to the people, promising, mispromising, and know anything on the ground. So the merchant and the fabrics of fake news identify this gap and use this gap in misinforming people through propaganda and fake news. So for government to win this war of misinformation and fake news in Nigeria, first of all, government have to win the confidence of the people, build trust between the government and the people, number one. And number two, government come with the policies concerning the issue of spreading fake information, especially on the social media pages. But the issue also on the social media pages is the issue of user-generated content. You know, those guys that are spreading fake news or misinformation, they are not illiterate.
Okay.
They are deliberately with the aim of what? Misleading the majority in the country. So they have their own aims and they have their own background on how they are going to counter the government, and government wants to approach them in terms of curbing or countering the fake news on the social media. So government have to win the trust of the people for it to win the misinformation and fake news campaign.
So government has to win the trust of people. But Mr. Mohammed, how the common people who are using social media, how the common people can take steps to ensure that they don't forward any fake messages or they don't spread misinformation within their own community or circle? Do you think people are, in Nigeria, people are careful enough to ensure that?
People are not careful enough for that because people are not aware. Majority of the people cannot differentiate between fake news and misinformation. Let me give you an example. This merchant of fake news, they have their own fake website. For example, you see BBC, but it is fake one. You see Voice of America, it is fake one. You see NTA, it is fake one. So if person is not carefully enough to differentiate between the fake and the real one, you can easily agree with them whenever they come with the news through the fake BBC website or through the fake CNN website. So people need sensitization. People need to be educated on understanding the differences, the fact that you can see and differentiate between fake news and the real news. So people need to be educated for them to understand how to differentiate the fake news. But as for now, people are not careful enough in spreading fake news. Innocently, people can see news thinking it is coming from the credible source. They can spread the news for the hope that maybe to stop the virus or to come out with the solution. But innocently, they don't know they are spreading the fake news or misinformation. So that's the major issue in Nigeria.
Yeah. Dr. Tripathi, if you can hear me.
Yeah, I can.
Both our panelists have pointed out lack of media sensitization, lack of media literacy as one of the main reasons for the spread of fake news and misinformation. Being an academician who has been working in this field for several decades now, what would you suggest for common people to ensure that they are more media sensitive, more media literate, and they are in a position to differentiate between a genuine news item and a fake news item? How is it possible for a common person to do that?
You see, there's a very long-term campaign is to be launched for this. Just as in India, we launch a campaign, awareness campaigns for vaccination, for cleanliness, for health and hygiene. So this is also a kind of mental health and the hygiene, not physical. So in that way, and the population is very diverse, you see. A lot of people still are illiterate, and if they are means not educated well. So this kind of, not only literacy can serve the purpose, but the education and awareness. You see, some efforts have been started. Even UNICEF has brought a module for instilling the sense of media literacy, and UNICEF is also stressing the university. They are coordinating with the university just to implement that module of media literacy, and gradually the efforts are continuing here. But there is a diversity, all kind of diversity exists here, and there is a very clear division. Even digital division is also there. So it will take a long time just to make people aware. Moreover, there are some people who are not ready to be aware. There is you see, the theory of individual difference is also functional here. Yeah? People are not ready to listen. If you will try to persuade them, try to tell them that this can cause a long-term damage over the country, over the society, they are not listening, because whatever they think that this is only right. And parallel, the propaganda machinery is also active, and propaganda machinery is also very strong. So, but we should not be desperate. We should not be hopeless. The people from academics, from the aware people from the society, they should continue their efforts. We have to carry on the media literacy efforts in the society.
Talking about media literacy, a very good development in India, which I have seen in the last 1.5 months, is that a lot of content is being generated now in the regional languages, which people can understand. In a country like India, which has multiple languages, multiple, ways to reach people, they have their own cultural ways to understand Corona and the COVID-19 crisis. So a lot of regional content is being generated and being disseminated to people in the country. I think that is one way of making people understand and give them more standardized information on how to protect themselves from COVID-19, and also what to believe in and what not. So going forward in the program, there were several news items in the recent past where we have seen that cyber crimes like child pornography are on the rise during the COVID-19 lockdown period. A lot of news is coming out about domestic violence against women in houses in different countries. A lot of news is coming in about violence being used against children. So in a way, crime online and in physically in the real life, both are on rise during the COVID-19 lockdown. So how do you see, Dr. Tripathi, what kind of cybersecurity laws do we have to contain the problems like child pornography, or we don't have any such strong laws currently?
Strong laws are there, and whenever it is found, it is the law is promulgated and arrests are made. But the problem is it is very difficult to find it out. It in a very latent way, it continues. This process or this phenomena continues from person to person. So this is the major problem. And when it is found and it is seen by the authorities, then action is certainly being taken here, and there have been arrests also against the child pornography, people who were using it. You see, and other thing that you have told, you have mentioned, this kind of pandemic, just as there is domestic violence. In India, it has been observed that there is a mob lynching this kind of thing. So this also happens that the mental health also comes under threat during pandemic. People, there is a fear psychosis, or they feel threatened for their life, and that this is a psychological factor. And because of this fear psychosis or threat, they become very offensive. So in this way, this kind of depression, this kind of frustration, and this kind of you can say the mental, that causes the mental disorder. And because of that mental disorder, a lot of criminal cases, a lot of cyber crime is being observed here also, and that has become very rampant. So along with, in my view, along with the physical health of the people, and a lot of organizations in India, they have also started an effort, the mental health of the people should also be observed, and it should also be taken care.
Okay, so I think the spurt in watching the pornography, especially child pornography, is also a signal of, mentally
Psychological disorder.
Psychological disorder among
Yes.
people during the lockdown. Coming to
Yes.
you, Mr. Idris Mohammed. Mr. Idris Mohammed, if you can hear us. Mr. Mohammed,
Hello.
can you hear us? Yeah. So
Yeah, I can hear you.
So what kind of cybersecurity framework is there in Nigeria, especially when it comes to issues like child pornography? Do you think there is a strong and credible cybersecurity network or framework established by the government in Nigeria?
So, coronavirus provided conducive atmosphere for the cyber criminals to get money and create a lot of disruption. So, they came up with the fake websites where they would disguise in the name of maybe government will provide palliatives through this website, or we are selling drugs for the COVID-19, or we are selling cheap products and food items at the lowest price through this website. So a lot of issue of cybercrime is taking place through this COVID-19 pandemic. But when it comes to the issue of child pornography, it is issue of psychological disposition, and it is very difficult for you to understand the issue because it is extremely private. Someone locked down in a room watching pornographic movies and or involved in any pornographic activities is online. So Nigeria have this law written, but specifically the law is not applicable, and there is no specific punishment, or there is no anybody that is being punished because of cybercrime or because of child pornography right now in Nigeria. But there are a lot of atrocity concerning this issue of cybercrime and issue of child pornography going place in Nigeria. And also issue of domestic violence against women, because the victims and the perpetrators are living in the same room. They are living under the same roof. A lot of abuses against women, a lot of sexual gender-based violence is going on because as a result of lockdown. And a lot of cases are being reported daily, and the legal issues is not putting in place to stop the violence.
Okay, so there is no strong legal framework in the country to take care of issues like child abuse and child pornography. I think as far as cyber laws are concerned, the anonymity that internet provides gives a lot of advantage to people to bypass these laws, and making it very difficult for the authorities to act and bring them to book. Coming to you, Mr. Izio Ganamdi, you heard our two panelists talking about the issue of cybercrime and the lack of enforcement because of various reasons. What's your take on this entire issue in the context of COVID-19?
Basically, I think we would not talk about mental health without talking about the socioeconomic status of individuals. Most times when you look at people who face issues such as this or who propagate such issues, there are people who fall mostly below in the socioeconomic strata. They don't do well mostly, and they live in a remote environment mostly. They do not have proper access to information, because those are the ones who even go further to make these crimes physical. The people who have internet access, who are doing very well, they live in comfortable environments. They could only propagate it virtually. And most often the virtual effects are not that physical as compared to those who fall below socioeconomic statuses. So if we would look at the government angle, I think what we just need right now would say social media watchdogs. Facebook has tried in so many ways, I think, to curtail the effect of such misinformation and disinformation, spread of false news, by initiating so many things. Like you have this fan badge and the blue badge for proper identification of original pages, but it's not enough. This is not enough, because civil society needs to come in, institutions need to come in, people need to take responsibility of their actions, because what happens here is the fact that we do not take responsibility. When you spread an information, you should be held accountable for the spread of that information. Such kind of laws, when implemented, would actually help to avert the issues that we're facing right now when we talk about misinformation and spread of false information. And in terms of gender-based violence, I really think a kind of a sensitization needs to be spread, particularly to the women, because they are the ones who mostly fall victims of this, and the children. They need to have this inferiority complex, which most times exists among them, to be lifted. Society needs to embrace women more. Women need to be given their rights as human beings. Their fundamental human rights have to be upheld by society. It's our whole collective responsibility. So I think this is my position on this: the government taking responsibility and individual playing their roles.
Individual playing their role. So I think, as Mr. Namdi said, we need more social watchdogs, and I think each of us, every responsible citizen can be a social watchdog. And if we try to curb this menace in our own handsets, and I think it will play a major role in curbing the spread of misinformation and disinformation during COVID-19. So gentlemen, that brings us to the end of this show. Thank you so much for joining us today. I think at a time when billions of people are under lockdown, and the risk of misinformation poses to public health has never been greater. So I think we have a huge responsibility. Each of us, each responsible citizen has a very important role to play to curb this infodemic in the coming weeks and months as the coronavirus spreads in other parts of the countries. I think that will be one of the way to ensure that communities and people are not targeted because of a propaganda and because of an agenda based on hatred. So Mr. Idris Mohammed, Mr. Yuganamdi, Dr. Sarvesh Tripathi, thank you all of you for joining us today in this wonderful discussion. And viewers will be back on Monday in a special show on the occasion of Africa Day. And we'll have 3 wonderful panelists from the diplomatic sector who will be joining us for a discussion on India and Africa relations. So all of you, thank you so much. Good night and goodbye.
Welcome.
Thank you very much.